If you've tried every scrub, every brightening cream, switched deodorants 3 times, and your armpits still look darker, patchier, or just different from the rest of your skin, this video is for you. Underarm color can feel like a purely cosmetic issue, but sometimes it's your skin quietly hinting that something else is going on, like friction and irritation, an infection, hormone changes, or signs of insulin resistance. Today we're going to separate what's usually surface level and manageable at home from what might deserve a proper medical check. We'll cover what normal can look like across different skin tones, common everyday causes of darkening, the medical patterns you should recognize, what you can safely do at home, and when to see your GP. The aim here isn't to shame cosmetics. It's to help you recognize when your underarms are asking for healthcare, not just another product. First, a reality check that helps. Armpits aren't meant to look like airbrushed adverts. They crease, they fold, they've got sweat glands and hair follicles, and the skin there often looks a bit darker or feels a bit thicker than the skin on your forearm. For many people, especially with medium to dark skin tones, it's normal for skin folds like armpits, groin, and inner thighs to have deeper pigmentation. You may also notice mild shadowing, visible follicles, or small bumps, especially if you shave or wax. So the question usually isn't, why don't my armpits match my arm? A better question is, has the color or texture changed noticeably over time? And is it linked to irritation, products, or something else in my health? That's how you separate normal variation from something worth checking. Let's start with the most common causes, the ones that are usually cosmetic level issues. 1. Friction and chafing. The underarm is a high friction area. Skin rubs on skin and skin rubs on fabric. Over time, that rubbing can lead to thickening and darkening. It's your skin trying to protect itself, similar to how palms toughen with repeated use. This is more likely if you wear tight sleeves, certain synthetic fabrics, exercise a lot without breathable clothing, or have more skin-to-skin contact in the area. 2. Shaving, waxing, and hair removal. Hair removal can trigger irritation and tiny injuries, even when you can't see them. That irritation can lead to post-inflammatory hyperpigmentation, meaning the skin heals darker after being inflamed. You can also get a shadow effect from hair roots under the skin, especially if you've got dark hair and lighter surrounding skin. 3. Deodorants, antiperspirants, and fragrance sensitivity. Some products can irritate the skin, especially if they're heavily fragranced, alcohol-based, or you apply them straight after shaving. You might get stinging or burning, then redness or itching, and later a darker patch as the skin heals. That's not you being dirty. It's a barrier reaction. 4. Hormone changes and pregnancy. Hormones can affect pigmentation. Some women notice darker underarms in pregnancy and sometimes in perimenopause, or after starting hormonal contraception or HRT. This kind of pigmentation may fade over time, but it can also persist. These causes are very common. They can affect confidence, but they're not usually dangerous. However, there are patterns where underarm darkening or texture changes can be a clue to something deeper. So let's talk about those clearly. In Acanthosis nigricans, which is a key sign of insulin resistance, one of the most important patterns to recognize is skin that becomes darker, velvety, and slightly thickened in skin folds. You'll often see it in the armpits, the back of the neck, and sometimes the groin. It can look like a dirty patch that doesn't wash off, and it tends to develop gradually over weeks to months. This pattern is commonly linked with insulin resistance and a higher risk of type 2 diabetes. In some women, it can also be associated with PCOS. So if you're noticing this kind of velvety darkening, especially alongside things like weight gain, irregular periods, excess facial or body hair, acne, or a strong family history of type 2 diabetes, it's a GP conversation, not just a skincare one. Armpits are warm and moist, which is perfect for yeast and fungal overgrowth. This can cause red, sore, itchy patches. Sometimes the skin looks raw or weepy. You might see small red satellite spots around the main area. After the redness settles, it can leave brown staining or darker patches. This is treatable, but it usually needs the right antifungal approach. Bleaching products won't fix it. If you get repeated painful lumps or boils under the arms, or you've had scarring, tunnels under the skin, discharge, or ongoing tenderness that can suggest hidradenitis suppurativa, or recurrent bacterial infections, HS is an inflammatory condition. It isn't caused by poor hygiene, and it deserves proper medical treatment, because controlling inflammation and infection matters more than color. Eczema, contact dermatitis, and inverse psoriasis can all affect the armpits. After repeated flares, the skin can heal darker, especially in people prone to post-inflammatory hyperpigmentation. In these cases, the color is often a consequence of inflammation. So the most effective approach is treating the underlying skin condition. If your main issue is dark underarms, self-care isn't about scrubbing the area into submission. It's about reducing irritation and supporting your skin barrier. Here are practical steps that tend to help. Go gentle with cleansing. Use a mild, fragrance-free cleanser once daily. Avoid harsh scrubs, loofahs, and aggressive exfoliation. Pause strong brightening products if your skin is stingy, red, or flaky. Overusing acids or strong lightening creams can worsen irritation and lead to more pigmentation. Adjust your hair removal routine. Use a clean, sharp razor. Shave with the direction of hair growth where possible. Avoid dry shaving. And if shaving always triggers bumps and dark marks, consider switching methods. Try a gentler deodorant. Look for sensitive skin, fragrance-free formulas, and patch test new products first. Choose breathable fabrics. Cotton or moisture-wicking materials can reduce sweat and friction, and avoiding tight seams can help if you're already irritated. And if you suspect something systemic, like Acanthosis nigricans, it's worth thinking beyond the skin. Small, steady changes like balanced meals, regular movement, and cutting back on sugary drinks can be part of addressing the root issue. Use changes as information, not as a reason to panic. Book a GP appointment if you notice new velvety, thickened darkening in your armpits, neck, or groin developing over weeks to months. Darkening that's spreading or becoming more textured despite gentle care. Recurrent rashes, boils, or painful lumps under the arms, especially if they scar or drain. Itchy, sore, or weeping skin that doesn't improve within a couple of weeks. A new or changing mole or irregular pigmented patch. Seek urgent advice if you have rapidly spreading redness, severe pain, fever, or you feel acutely unwell, because that can suggest a more serious infection. A supportive GP will usually ask when you first noticed the change and how it's evolved. They'll ask about deodorants, shaving or waxing, and irritation triggers. They may ask about symptoms like increased thirst, frequent urination, weight changes, fatigue, period changes, or features of PCOS. They'll examine the area and may check other skin folds too, because the pattern matters. Depending on what they see, they might do blood tests like HbA1c or glucose to assess diabetes risk. Consider cholesterol tests and other metabolic checks. Arrange hormonal tests if PCOS is suspected. Take a skin swab if infection is likely. Refer you to dermatology for ongoing skin issues or suspected HS. Refer you for metabolic or diabetes support if insulin resistance is a concern. The goal is simple: work out whether this is mainly irritation and pigmentation, a chronic skin condition, an infection, or a clue to something metabolic, so treatment can actually match the cause. If your main concern is confidence and appearance, it's still completely valid to ask for safe options once medical causes are ruled out. If you've got a strong family history of diabetes, PCOS, or metabolic issues, underarm changes are even more worth mentioning. And if you've been dismissed before, you can say, "I understand it might be cosmetic, but this is new for me, and I'd like it assessed properly, including blood tests if needed." That's not overreacting, that's advocating for your health. Dark underarms don't make you unclean, unfeminine, or doing something wrong. Sometimes it's just friction and irritation. Sometimes it's an infection or inflammation that needs treating. And sometimes it's a clue your body might benefit from a bigger health check, especially if it's happening alongside things like irregular periods, acne, unwanted facial hair, or weight changes. Either way, you deserve answers that go deeper than another tube of cream. If that combination sounds familiar, tap the PCOS video on your screen now. I'll walk you through the symptoms, tests, and treatment options clearly and without shame.